afternoon, everybody. Thank you for joining our Retirement Benefit Awareness webinar. I'm Cassie and this is Nicole, and we're Communications Specialist here at the Fund Office. Before we get started with our webinar, I just want to show you guys how to go about asking questions during the webinar. You can ask questions at any point, but they will be answered at the end during a question and answer period. If you're viewing this webinar from a desktop computer, type your questions into the chat box on the right-hand side of your screen where it says type your message at the bottom. This will be only viewed by the fund staff and all of your questions will be hidden to all other viewers. If you are viewing this presentation from a mobile device like this, you can just select the chat bubble on the bottom right-hand corner to bring up the chat screen and type your questions in here. And once you're done, just exit out on the top left-hand corner to come back to the live webinar. If for any reason you accidentally exit the webinar, don't worry. Just select Join Room, and then once it loads, Join Room again to come back to our live spot in the presentation. If we don't get to your questions for any reason, it may not have pertained to tonight's material or had contained personal information, and someone from the fund office will reach out to you later. A quick overview of our webinar tonight. We'll start with the introduction from Cassie and I, followed by a health and welfare overview from Mike Wagner, the medical manager. Then go into your pension, annuity, and your savings plan from Joe Obahowitz, the fund director, closing with a closing and question and answer from the fund staff. Just a reminder of some important resources we have here at the fund office. We have our website and mobile app, carpenters.fund. We just gave our website a whole new makeover to make it easier for you to come on and find exactly what you're looking for. Our website, you can find all the information you need to know about your benefits, your retirement accounts, and anything benefit fund related is on our website. You can also access your member profile, which I'll get to in a second. We send out monthly newsletters via email and mail. This pertains benefit information, benefit updates, some health tips, ways to use your preventative health care so you can stay healthy. We also post our benefit updates on our social media pages. We have Facebook, Instagram, and YouTube. So if you just search Carpenters Benefit Funds of Philadelphia, you can find us on there. Be sure to give us a like, a follow, and subscribe to our YouTube channel. Here is a snapshot of what your member profile looks like. You have your personal information, your address up top. If you do move for any reason or change your address, you can update it with the fund office right on the website, which is super important, so make sure you do that. Below that, you can see your health and welfare eligibility status. We do have a new eligibility period coming up in November, so be sure to check that out. You can also view your work history, your hours worked, and your employer contributions. And below that, you can view your annuity account balance. And there's also a menu to the left where you can do so much more. So be sure to check that out on carpenters.fund. I'm now going to hand it over to Mike Wagner, the medical manager, to give you an overview of your benefit coverage now and into retirement. Thank you.
All right, thank you, Cassie and Nicole. Good evening, everyone. My name is Mike Wagner. I manage the medical benefits here at the Carpenters Fund. Tonight, what I want to give you a brief rundown of, it's your medical plan that you're currently entitled to if you have our active healthcare coverage. That's the same medical plan that you carry into retirement eligibility if you earn that. It's your preventative care, how we want you to make sure you're paying attention to disease prevention as opposed to disease reaction. Your eligibility as a retiree, you're all here because you want to know what retirement's going to look like. How do you qualify for health and welfare coverage and what does that look like? If you do retire eligible with the fund, when you hit Medicare age, how does that impact your eligibility? And in the event that you don't qualify for coverage with the fund office, what are you entitled to? And that's the Cobra coverage. We'll go over that very quickly as well. I don't want to go into the minute details of each one of our coverages. I just want to mention what you're currently entitled to as an active carpenter, and that reason is that that carries over same plan when you're eligible as a retiree. It's broken into 4 major categories. It's our major medical through independent administrators, our behavioral health coverage through mental health consultants, our prescription coverage through Express Scripts, and our in-house benefits. Those are the benefits that the fund actually administers here at the fund office. Primarily, those benefits have stayed the same. There is a change to our prescription benefit, a small one, And there's going to be changes to our in-house benefits that I do want to mention and make sure you're aware of. Prescriptions, like I said, primarily stayed the same. A small change that occurred in the summer in July. It's still a $5 and $10 copay plan for generics, still $75 and $150 for brand drugs. What I always tell people is if you don't get a prescription that costs one of those two numbers, 5 or 10 generics, 75 or 150 for brands, please call the fund office before you pay for that. A lot of times it's an administrative error, or it might be a drug that's not covered, but there's an alternative on file that we can cover for you. So call us before you pay that. Make sure we can help protect your money, make sure that they're putting the drugs through the right way and that the fund is paying for that. One way that you might see that those numbers change, if you were used to using Rite Aid Pharmacy for your generics in the past, they waive that $5 and $10 copay. In July of this year, unfortunately, we weren't able to continue that contract with Rite Aid. Rite Aid wasn't able to honor that free generic. Express Scripts came along and did have a different contract through CVS Pharmacy. It's not free generics, so for all generics now, you're going to pay the $5 or $10 copay. The one advantage to using CVS is any drug you fill more than 3 times is going to be called a maintenance medication. You used to have to go exclusively to mail order for that. You had to get it in the mail from Express Scripts. Now you have 2 options. You can still utilize Express Scripts if you're used to that, if you're comfortable with that. Or if you're better walking into a storefront, walk into any CVS on earth, and they can fill that 90-day supply again after your 3rd time, what would be considered maintenance meds. So that's what you want to know. Unfortunately, no more Rite Aid for the free generics. And anything more than 4 fills, make sure you're filling at either Express Scripts or at a CVS. Again, if you run into a drug, let's say you go to Rite Aid and they're going to charge you the full amount of the drug, $400. Call the fund office. We can make sure to steer you in the right direction. The change to the in-house benefits, what we mean by in-house benefits, it's really into now 3 buckets. It's your dental and orthodontia or your braces benefit, your vision benefit, and your ambulance benefit. If you take an ambulance ride, that bill comes to the fund office. We make our payment to the ambulance company. Where the changes are going to come, it's to the dental plan and to the vision plan, and those are expected to be announced for the start of the next plan year, which will be May 1st, 2022. The girls mentioned all of the ways that we communicate to you, and you're going to hear me mention it a lot. There's going to be 2 things I repeat over and over. Get a physical, and make sure to check carpenters.fund. If you don't know your benefits, for any new benefits that are coming out, read the newsletters, check carpenters.fund, make sure you know what's coming out and what you're entitled to. We're going through the process now of selecting a dental vendor and setting up a plan design for that. Same thing for vision. We're considering moving that out of the fund office and setting up with an actual vision provider. When we know those details, they're all going to come out in those 2 avenues. In the Carpenters newsletter, make sure you're reading that, and please visit carpenters.fund, make sure you know about that. But as those details come out and we know more, we'll make sure you know more as well. Some of the newer benefits that I want to make sure that you're aware of in case you missed them in the newsletter, make sure you take advantage of them if need be. AudioNet America does our hearing aid benefit for us. Hearing aids are very, very expensive. The fund pays $1,200 toward that benefit. To make sure you know what you have to pay out of pocket, AudioNet comes in and gives you a fixed out-of-pocket cost. So in the event that you need a hearing aid in the future, please, again, come to carpenters.fund, click on the link for AudioNet America, and make sure you're utilizing one of their providers so you know exactly how much you have to pay out of pocket. I mentioned at the start that tonight we're going to go over our preventative care benefits and how important the fund office thinks it is to make sure you're being proactive about your health. The reason is, and I'm going to get into stats, how prevalent cancer is not only in America, but in the carpentry industry. In the event that you do get diagnosed, God forbid, with cancer in the future, the board wanted to pay special attention to that, make sure that there was no barrier to getting the right care and providing the right coverage. So what we did is we partnered with Cooper Hospital over in Camden. Their cancer branch is called MD Anderson. They're one of the highest ranked customer service facilities in the country. MD Anderson, if you go there, they will waive your 10% coinsurance. Our major medical is a 90-10 plan. They will waive that 10%. In all likelihood, it's going to save you the full $2,000 you'd have to pay out of pocket. if you use MD Anderson. So again, God forbid you get diagnosed, you, your spouse, anyone in your family gets diagnosed with cancer. Make sure you know that MD Anderson is out there. Make sure you know it's available to you so you can save that $2,000. Make sure again that there's no barrier to getting the right treatment. Some of the other $0 copay benefits that I want to make sure you're aware of, we've had them for a while. The two that I want you to focus on, the newer ones, are MD Live in the top left corner, One Drop in the bottom right corner. The other ones we've had, Progress Physical Therapy is free physical therapy. Obviously in the carpentry industry, things go bad, you might need physical therapy in the course of your career. If you use a Progress location, or they're now called IV Rehab, is in our network as well. They'll waive the coinsurance, so there's no reason to not go. Healthcare Solutions we've had forever. They do our radiology benefit at no cost. LabCorp is still our blood work provider of choice. If you utilize a LabCorp, they'll waive the 10%. You get that paid at 100%. And our Temple Health Heart and Lung scans, I'm going to get into in a couple of slides. Make sure you know they're available to you, and again, at no cost. But the two I want to highlight, MD Live is an app for your smartphone. Basically, it replaces an urgent care. You log into MD Live, you can FaceTime a doctor right then and there. No need to leave the house. No need to leave the job site if you happen to be on it and have a sore throat or allergies, or you need a medication filled. Make sure you download MD Live. Get registered for it before you need it. If you have kids at home, this is crucial. They get sick in the morning before school, before you have to be at work. Again, no need to run them out to an urgent care. You can log right in, FaceTime, you're done in 15 minutes. It's free. There's no coinsurance for that, so make sure you know that benefit. Make sure you have that app downloaded. The newest one is the bottom right corner is One Drop. If you happen to be diagnosed diabetic, unfortunately, as you get closer to retirement, you get closer to age 50 or 60, diabetes becomes a threat to your health. If you do get diagnosed diabetic, you're going to require test strips, lancets. To take care of yourself in the best way, you're going to require a health coach. One Drop provides all those things at no cost to you. So again, if you're diabetic right now, make sure you have the One Drop app. Make sure you've registered for that so that the fund is paying for all those materials for you. You're getting that coach for free as well. If you're diagnosed diabetic in the future, just keep it in the back of your mind. Visit carpenters.fund. Know that One Drop is out there and is a benefit you're entitled to. Like I said at the start, that's just a very quick recap of what our benefits are. We have a lot of benefits, a lot of carve-outs, thankfully. Our benefit package is very rich. You guys work very hard for that, and we take pride in the amount of benefits that we offer. But there are a lot of them. If I missed anything in there, if there's anything you have more questions about, please ask during the Q&A. Or when this is over, visit carpenters.fund. There's the full list of our benefits, what they mean, what you're entitled to, and how to access them. But the important thing is we start to get toward retirement age. It's great to have a very rich benefit package, but it doesn't do you any good if you're not using it the correct way. For the past few years, the mantra at the fund office has really been more proactive than reactive. Unfortunately, in healthcare in America, all too often we don't do anything until a problem has come up. We're too reactive. We wait, and unfortunately, as middle-aged men, we wait probably a little bit too long to react to it. What we want to encourage you to do is don't wait at all. Be proactive, get your preventative health done, know where you stand from a health standpoint. And the ways you can do that as a middle-aged man, two major ones, is your colorectal screening starting at age 50, your prostate screening starting at age 50 as well. Unfortunately, they're uncomfortable tests to get done, but it is an important conversation to have with your doctor. Make sure you know that those things are things you need to be getting done. Have a conversation with your doctor and get them done at the right time. The screenings for women, it's the breast cancer screening starting at age 40 is your mammogram, your cervical cancer screening, and then again the colorectal screening, and that starts at age 45. The reason that we bring these up, and I mentioned that I was going to get into stats. The stats in the nation are not good for cancer. Unfortunately, for whatever reason in the construction industry, we see that actually as a higher prevalence. We're worse than the national average. The stats around cancer, colon cancer and prostate cancer being the big one, they say it's either 1 in 6 or 1 in 8 people in their lifetime starting at age 60 are going to experience one of these two cancers. Unfortunately, 1 in 8. What that means, if there are 400 people logged into this webinar tonight, That means what, 50 people are going to potentially get cancer in their lifetime? The stats on survivability, if it's caught early, stage 1, the stats now in America, the survivability is up in the 90%. 9 out of 10 will beat that cancer and continue to live a good life in their retirement. Unfortunately, if you do the reactive thing, you wait until you experience a problem, you wait till it gets worse, and then finally you go to the doctor to figure it out. Survivability drops from 90% to 20%. So as opposed to 9 out of 10, unfortunately, it's 1 out of 5 are going to survive that. Don't be the person that reacts. Unfortunately, if you are that 1 in 8, make sure you're catching it early. This is why we harp on these screenings. Make sure you're getting them done. There's no reason not to. There's no cost to you. Make sure you're in that 90% surviving rate if, God forbid, this is something that you deal with in the future. You hate to work as hard as you have to get this close to retirement, only to have your retirement plans derailed by something like cancer and have caught it too late. In order to encourage you, look, we know that it's uncomfortable to have to go for a colorectal screening. No one wants to do it. Our rates, they call it a gap in care. We were once described as abysmal. Abysmal is what they called us in terms of people that actually go get that done on time. In order to try to encourage you to do that more often, to do it on time, there's what's called the ColoFit test. It's actually just a screening you do right at home. You mail it back. The test is going to tell you if there's blood in your fecal matter. If that's a concern and you need to talk to a doctor about going through the whole colonoscopy and getting a cancer screening. This is covered at no cost to you. The fund pays the full thing. The link's here on the screen. Click on the link. Make sure you get a kit sent to you tonight. Get the kit done, again, at no cost to you. Know where you stand. Get it done. Know where you stand. Best case, put your mind at ease that you're in good health. Worst case, at least you caught it early and you know the steps you have to take. The other preventative care measure that I want you to be aware of, we're pretty excited about it at the fund office. It came out February this year. We've offered our comprehensive fund physical for what feels like forever now. We had about 12 to 15 providers that would handle that for you, with Jefferson being our big one. Unfortunately, we've started to lose that as the hospital chains start to gather up some of those smaller offices. But Patient First approached us and said, look, we can do the comprehensive physical for all of the carpenters with, again, no barrier to getting that care and the coverage. You can walk into any Patient First in the region. There are 76 locations in the area that the fund covers. It doesn't cost you a thing. They are open 7 days a week. They don't close. And they're from 8 to 10 p.m. We understand. That's always what we hear when we tell people, please go get a physical. We know that you guys have to work. You have to meet the hours in order to get healthcare coverage. You don't want to take the day off and potentially impact that to get a physical. Patient First said there's no need to worry about that. If you get out of work at 3 or 4 o'clock in the afternoon, they're open till 10. The physical takes about an hour, and again, best case, it tells you where you stand. You get a full blood panel, you get a full EKG, you know exactly what you're looking at from a picture of health. And in order to make sure that you're going to get this done, and I don't just mean the members, it's not just for the carpenters. Member, spouse, or any dependents age 16 and up. But for the member and the spouse, if you go to a Patient First physical, the fund will mail you a $25 Target gift card. That's for both the member and the spouse. So if you make a date of it, you'll get $50 to Target. It doesn't cost you a thing. There's no reason to avoid it. And I can't say it enough, please take advantage of this. If you're not going to do anything else to be preventative, at least go get the physical. Know just your general numbers and where you stand from a picture of health, and get that $25 to Target. The other two major screenings that we want you to know about as you get older, if you're over 40 if you're a male, over 50 if you're a female, is our temple, heart, and lung scans. The heart scan checks for calcium buildup. The lung scan checks for early detection of cancer in the lungs. If you've been working around, and of course in this industry you have been, sawdust, regular dust building up in the lungs, these two scans will tell you if you're at risk for either a heart event or cancer in the next 10 years. Call the fund office or visit carpenters.fund to get an authorization number. In the event that you go to one of these preventative screenings and something comes up on one of those tests, you're not sure what to do, or just in the event that, like I said, our benefit package is very rich. We have a lot of carve-outs, a lot of avenues you can take to help save money. The fund office has 2 nurses on staff They're trained by Temple Hospital. They're employed by the fund office. One sits right in our office. One is out on the road visiting you guys in the hospital. It's our fund nurse team, Nurse Fran and Nurse Nicole. Take advantage of them. They're here as an advocate for you. If you do go into the hospital and are recently discharged, you might get a call from Fran. Answer that call. All she's doing is making sure that you know your discharge paperwork, if you're on a new medication, if you have questions about that. But don't hesitate if you have general benefit questions, you're unsure of something that you think you could be doing better in terms of selecting a provider. If you need help getting a primary care physician, or if you go to that patient first physical and they find something, your cholesterol is high and you're not sure how to handle that, reach out to the fund. Their email is here. It's care@carpenters.fund. Reach out. They're an advocate for you. They don't report back to the fund, to your employer, to the board. They're just here to help you understand your benefits and make sure you're getting the right care at the right time. Again, I can't say it enough. Preventative care means more to us at this point than probably anything. There's a lot of ways that you can access that. Call the fund nurses, visit the website, go get your stuff on time, and please take advantage of that patient first physical. There's no reason not to. Do it once a year. Joe always says, just like we get our cars inspected, we take better care of our cars than of ourselves. Let's change that. Go to a patient first, know what your numbers are, know where you stand. One of the benefits outside of preventative care that I want you to understand is how your HRA works. It's your health reimbursement account. That helps cover any of your out-of-pocket costs. Your out-of-pocket costs, it's a tax-free reimbursement. So your employer is actually contributing to this per hour depending on your collective bargaining agreement. But if your employer is contributing to this, it's tax-free. It's going into an account through a company called ProFlex, and it covers your out-of-pocket for medical, for dental and vision if you happen to have an out-of-pocket there, or it can help cover your insurance premiums when you move to retirement and pay a copay, which we'll get into, or if your spouse is working and they have post-tax, which is rare, but if they have post-tax health reimbursement coverage. ProFlex administers this. There's two ways to access it. It's the blue MasterCard on the left, or if you're more comfortable, if you pay out of pocket with your own debit card, then in that case you load receipts through the web portal or their mobile app. The real question is, you've been building this account up, it's tax-free, it's paid in by your employer, it's your money to use to help pay for those coverages. What happens to that HRA account when you retire? An HRA is not similar to an FSA. Some of your friends, or if your spouse is out working, might have an FSA. That's a use it or lose it. At the end of the year, if you haven't used the money in that account, unfortunately you lose it. An HRA is not like that. An HRA just continues on year over year. There's no difference when you retire. So if you have money in there when you come in to retire, that's your money in retirement. It can be used to help pay for your copays if you qualify for health care coverage. And in the event that you pass away, if your spouse or your kids are still on file with us and eligible, they can access the money in that account as well to help pay for their medical out-of-pocket costs. So how do you meet the eligibility requirements as a retiree? Like I said at the start of this, your active healthcare coverage, the same as your retirement healthcare coverage, and that's a big point. You do have to be eligible for the active eligible benefits when you come in to retire. Unfortunately, if you miss the benefit period and you come in to retire, even if you have the years and the qualifications, you wouldn't be eligible for retirement healthcare coverage. So that's something, as you start to envision that roadmap of when you're going to retire, make sure you know that it needs to be in a benefit period when you have active healthcare coverage. The years that you need to meet, it's broken into two classes. There's Class 1 retiree and Class 2 retiree healthcare coverage. The major difference is going to be the amount you pay a month. But in order to qualify for that, for Class 1, you need 30 credited pension years. You need 60 consecutive benefit periods. I'll get into what consecutive means in a moment. Class 2, slightly less, 25 credited pension years or 50 consecutive benefit periods. So what do we mean when we say consecutive? When I say consecutive, what I don't mean that if you've worked 29 good years you've hit benefit periods every time, and unfortunately COVID comes along and you miss one, then now you're starting over like an apprentice. For us, what consecutive means is if you miss the benefit period, you just have to make that benefit period up. So a very quick example, Joe Wages working in the mid to late 90s, unfortunately didn't earn eligibility for the May 1997 or November 1997 benefit periods. That would be considered a gap. So he's no longer consecutive. But you can see in the green, Joe comes back, he earns May of 98 and November of 98. That would be considered consecutive again. He missed 2, he made up 2, he covered the gap. The difference, as I mentioned, between the two classes, class 1 has the higher years, so it's a lower copay. The copays are age tiered, so if you qualify for health and welfare, there is a monthly copay you pay in order to have that coverage. Age tiered, if you're under age 62, it's $135 a month. If you're age 62 to 64, it's $100 a month for the member or the spouse. The kids, because presumably they're always going to be under 62, they remain at $135. When you hit Medicare, it drops significantly to $25 a month. Again, that's $25 for the participant, $25 for the spouse. The copay is for kids as a bucket, whether you have 1, 3, or 5. You're going to pay that one flat copay to cover your children. Just as a very quick example, we'll look at age 62 to 64. If it were yourself, your spouse, and 3 of your kids on file, you'd pay $100 for the participant. Assuming that your spouse is also age 62, you'd pay $100 for the spouse, pay $135 for all the kids. So a total of $335 a month, and that's taken right out of the pension payment. For class 2, since you had the lower years, you had the 50 and 25 instead of the 60 and 30, the copay is going to be slightly higher. So for age 62, it's $250 a month. Age 62 to 64, it's $215 a month. When you hit Medicare age, same as class 1, it's going to drop to that $25. And the rules are the same, member and spouse, and kids as a bucket. The reason that we drop the copay when you hit Medicare, you're typically entitled to Medicare when you turn age 65. It's broken into a couple different parts, Part A and Part B being the significant ones. There's also Part D, which is your drug coverage. Traditionally, the month you turn 65, you're eligible on the first of that month. Medicare is going to automatically try to enroll you in Part A and Part B. Unless there's a reason that you're not entitled to Part B, you're going to get both those automatically. It'll show up in a card, traditionally sent out about 90 days before the month you turn 65. The fund at the same time is also going to send you a letter asking you to send us a copy of that card. Once we know you're eligible for Part A and Part B, you've signed up with Medicare, we're going to enroll you in our Medicare program. So Medicare pays first, the fund pays second. That's why that copay comes down. It includes full Part A, full Part B at no copay to you currently, and no copay for those services. You do pay that $25 copay. No copay for the services, and it does include a Part D prescription plan. So if you're coming up on age 65, the most important thing I can tell you is look out for mail from the fund office. If you have questions, call the fund office, please. Don't listen to your friends. Unfortunately, if your friends are not carpenters, they're not entitled to our benefits. They may be signing up for supplement plans through AARP. You don't have to do any of that. Call the fund office, look for our mailings, know what it means when you're moving to Medicare, and just know to, once you get that copy of that Medicare card, send it down here to the fund office so we can get you enrolled appropriately. That's how to be eligible for retiree healthcare coverage and how to access it, the copays and what becomes a Medicare. The important thing to know, unfortunately, what happens if you don't retire with healthcare coverage? Are there any options available to you to keep what you currently have as an active participant? If you don't qualify for healthcare coverage, you can, for a short period of time, continue to keep your active healthcare coverage while you go look for a plan on your own. It's called Cobra Coverage. Some of you may be familiar with that because you can get on Cobra as an active guy as well if you miss our benefit periods. Cobra Coverage allows you basically to pay what it costs the fund to maintain our benefits. You can pay it out of pocket and stay enrolled with us. This is government mandated, so their rules are their rules. We charge you what it costs the fund, and the amount of time you can pay is tiered. If you're a member, you're a working carpenter. If you were to retire without coverage, you can pay for 18 months. If you're a spouse or dependent who's been termed because the carpenter retired with no coverage, you can pay for 36 months. The same goes in the event that the member passes away prior to the spouse. If the member passes away, the spouse has run out of the coverage, they can buy Cobra Coverage to stay in the carpenter's plan for up to 3 years, 36 months, before they have to go shop for something additional. The rates do change on January 1st of every year. Again, we charge you what the fund pays. The current rates for single coverage, $560, $522. For a family coverage, $1,000, $356, and 53 cents. The important thing to note, because that is a health insurance premium, if you do have the HRA balance available to you, you can pay your Cobra and get reimbursed through the HRA. That's really it. I say that's really it. That's all of our slides. That's not the full amount of benefits. Like I said earlier, if there's anything I missed, if there's any questions you have, please ask them during the Q&A. Get on the chat and send them in so that we can get those answers for you. Call the fund office or visit carpenters.fund. Visit our YouTube channel. Please read our newsletter. Know the benefits that you're working so hard to get, know how to utilize them, and to make the best of them for yourself and your family. With that, I'm going to turn it over to Joe to talk about your pension benefits.
Thank you, Mike. My name is Joe Obahowitz, and I'm the Fund Director here at the Carpenters Benefit Funds of Philadelphia. My portion of the presentation, I'm going to go over an overview of your pension, your annuity, and your savings plan. Now, your pension is considered a defined benefit plan, and it's paid out to you on a monthly basis after you retire. The contribution is included in the benefit package from your employer. The calculation is based upon a yearly accrual that is set by the Board of Trustees and credited service you earn while you're working. The pension plan year starts every May 1st and ends every April 30th. Now tonight we're going to talk about retirement planning, your requirements for pension eligibility, your supplemental benefit, also known as the double bubble, and how you qualify, your monthly retirement options when you do decide to retire, and then I'm going to close with some examples of pension at retirement. Now the question you want to ask yourself is, do you have a target retirement date? If you do, you should note that all pensions start on the 1st of each month. You want to contact the fund office 6 weeks prior to that retirement date. We need the signed application and the paperwork received by the 15th of the previous month. If you're coming in for a retirement appointment, you should note that it takes about an hour for either an in-person appointment or for a phone call meeting. If married, your spouse is required to attend the appointment. Signatures need to be witnessed by a fund staff member or notarized if you are using the mail-in option. We do need copies of your marriage certificate, if you're married obviously, a copy of both you and your spouse's birth certificate, and picture identification, and we also need direct deposit information. Now, when can you retire? The earliest you can retire under our plan is the age of 52. In order to qualify and retire at age 52, you have to have at least 33 years of credited service. You can also retire early with full accrued benefits if you are the age of 53 with 32 years of service, the age of 54 with 31 years of service, the age of 55 with 30 years of service, or the age of 62 with at least 10 years of service. If you meet any of those qualifications, you can retire early with your full accrued benefits, meaning there's no type of reduction. However, you can retire at the age of 55, but if you have less than 30 years of service, your pension will be reduced. An example is if you have less than 30 years of service, you take a 3% reduction per year. So if you retire at 55 with less than 30 years of service, you would take approximately a 21% reduction on your pension. Your supplemental benefit eligibility, also known as the double bubble. Now, how do you qualify for that? Now, if you have 30 years or plus years of service, you will get your full supplemental double pension. An example is if your pension was $3,000, your supplement would be $3,000. Now, if you have between 25 and 29 years of service, you would get your supplement, but it would be reduced because you didn't have 30 years of service. Hypothetically, if your pension was worth $2,400, because it got reduced at the early reduction factor, your supplement would be $2,400. And again, that would be reduced for the early reduction factor. If you have under 25 years of service, you may be eligible for a supplemental pension. It depends on when you started, and it is tiered. You should also note that if you have less than 10 years of service under the pension plan, you do not get any type of supplemental benefit. Now, when will your supplemental payments stop? You should know that your supplemental payment will stop the month following a retiree's 62nd birthday. It'll also stop if you return to covered employment or work over the allowed 40 hours a month absent a waiver, if you're granted a Social Security disability award, if you attempt any type of fraud upon the fund, and the supplemental benefit will stop when the participant or the retiree passes away. Now let's look at an example of a member and a spouse, Joe Wages, age 55, and his spouse, Jane Wages, age 53. Now Joe has 30 years of service and he meets the rule of 85. He's 55 years old and has 30 years of service. Now let's look at the options that Joe and Jane will have to look at when they come in to retire. Joe, since he's a married participant, will have a straight life option, again where there's no reduction in his pension, a 50% joint and survivor option, a 75% joint and survivor option, and the 100% joint and survivor option. All of the percentages, the 50, 75, or the 100, will come with reductions in the event that Joe wants to leave something for Jane and for his pension to continue in the event that he predeceases his spouse. On the next slide, I'll show you how the factors work. Now, if we're looking at the retirement options that I just mentioned, the first one we're going to take a look at is the straight life option, or the SL. Now remember, Joe's pension, because he met the rule of 85, was $3,000 a month. His supplemental benefit doubles, so that's another $3,000. So when Joe at retirement is looking at a monthly pension of $6,000 a month up until the age of 62. Now, as you see under the straight life option, there's no surviving spouse benefit, and there's nothing to be left for this spouse in the event that Joe retires, and there's no reduction in his pension. If we look at the 50% joint and survivor option, Joe's pension, which used to be $3,000, is now $2,770. His supplement is then added to that, and the supplement is not reduced for the joint and survivor options because that only goes to the member. It does not go to the spouse after the member passes away, if and when the member passes away. So under the 50% joint and survivor option, you can see that Joe is taking the $230 monthly reduction plus the supplement. He's looking at a pension of $5,770 at retirement. In the event that he passes away, his spouse Jane would receive $1,385, which is 50% of Joe's pension of $2,770. If we look at the 75% joint and survivor option, obviously the reduction is a little bit higher. So under this circumstance, the pension, which used to be $3,000, is now $2,660. Again, you add the supplement, which is not reduced, and Joe's pension is $5,660 up until the age of 62. Now, if and when Joe passes away, Jane would receive $1,995 for her lifetime, which is 75% of the $2,660. Now, finally, the largest joint and survivor option is the 100%. Obviously, you're going to take the greatest reduction on that one. As we'll see, Joe's pension now is $2,570. You add in the supplement. So Joe's now looking at $5,570 per month up to the age 62. So it's a $430 a month reduction from the original $3,000. However, in the event Joe passes away, Jane would receive the full $2,570 for the remainder of her lifetime. One important note on this is when you come in, and this is very important when you have to make these decisions, that you really have to think about it. There's no one size fits all on these joint and survivor options. You really need to sit down and talk it out with your spouse. Some people have life insurance policies, some don't. You cannot change this selection. So once you make this selection at retirement, it cannot be changed. Regardless of whatever type of survivorship option you choose under your pension at retirement, you should also note that there are death benefits that would get paid to your spouse or your beneficiary in addition to the joint and survivor options if you choose them. So if we're looking at Joe's situation, his pension was worth $3,000. There's a minimum of 12 months with a maximum of 60 pension payments that would get paid to Joe's spouse or his beneficiary at the time of his death. So at minimum, Joe's spouse or beneficiary would get $36,000, which is 1 year or 12 months at the $3,000. There's also a flat sum pension death benefit in the amount of $6,000 if you have more than 20 years of service. If you have between 10 and 19 years of service, the lump sum death benefit is $3,000. If you have less than 10 years of service, there's no lump sum death benefit from the pension plan. And because he retired with health care coverage, there's an extra $1,000 from the health and welfare fund. So all in all, Joe's minimum death benefit that would go to his spouse or his beneficiary would be $43,000 at the time of his passing. Now this would be in addition to any joint and survivor options that he chose for his spouse to protect her in the event that he passed away and he wanted to continue his pension to her for her lifetime. Some other important pension features we like to discuss too is the pop-up benefit. Now what is the pop-up benefit? And this is only available to the retirees that elected the joint and survivor options, and this includes anybody who's deferred vested. The joint and survivor pop-up benefit comes into play. Now what happens if your spouse predeceases you and you were taking that reduction? Don't worry, you are protected in the event, if we're looking at the examples that I was showing you of Joe where he was getting $3,000 a month. However, under the joint and survivor options, he was taking reductions to leave something for his spouse in the event that he passed away. Again, however, if his spouse predeceases him, his pension will pop back up to that straight life amount. In Joe's case, it would be popped back up to the $3,000. Your annual pension statement. This is not something that's automatically mailed out from the fund office. You do have to request it once a year. Most participants will contact us around their birth date and ask for a new pension statement. So if you haven't done one or haven't received one in a while, now would be a good time to request it. You can request one once per year. And another important pension feature is the disability retirement. We do offer disability retirement. In order to qualify for the disability retirement, one, you have to be an active participant in the pension plan. You have to have 10 years of credited service before the onset of the disability. You have to provide a Social Security disability award that was awarded on or after May 1st of 2019. And you need to be unable to be gainfully employed in any type of occupation. Now, termination and or suspension of your pension payments, when do they stop? Well, your pension will stop when a retiree passes away. If you elected to joint and survivor, your spouses would then pick up from that option. If you attempt any type of fraud against the fund, if you do qualify for the disability pension payments, they will terminate if your disability ceases or you return to any kind of work, and your pension will terminate or be suspended if you return to covered employment in any phase of the construction industry or work over the allowed 40 hours a month absent a waiver or work in non-covered employment within the industry. Some other important features we'd like to discuss too is your change of beneficiary, and I can't stress how important it is to make sure that we have the most up-to-date beneficiary information on you from the fund office. If you haven't done it, please make sure you complete the change of beneficiary information, especially if you had a life change. In the event something happens to you, we want to make sure that any of your funds, any of your retirement accounts go into the rightful owners or the rightful person that you would want them to go to in the event that you do pass away. Change of address, obviously make sure it's very important that we have the most up-to-date address on you. If you change it with the union, just don't assume that it flows over to the fund office. You should do it to the fund office and union also, but just make sure that we are notified if you do move or have a address change. Reciprocal hours are very important. We're a big union now. The whole union covers a lot of areas. However, the fund offices are still regionalized. So if you do work in New York, you do work in New Jersey, make sure you fill out a reciprocal form. You can go online on carpenters.fund and complete one. You only have to do that once in your lifetime. And what that does, that allows us to go retrieve any hours that were paid into those outside funds. Divorce, unfortunately, this is a topic that we have to deal with, but divorce in your retirement, in the event that you are divorced, we do need to be notified, and we do need to see a copy of the property settlement agreement. The property settlement agreement, if you went through it, a divorce, unfortunately, basically states what you're doing with the house or any personal property, bank accounts, etc. We do need to see whether or not your ex-spouse is entitled to any type of those retirement benefits. In the event that you surprise us with any divorce paperwork right around your target retirement date, that will throw a wrench in things. So if you are divorced, it's important for you to get that information to us sooner rather than later so we can determine whether or not there's any further action that might be needed on your retirement accounts. Failure to do so could result in you not being able to retire on a timely basis. The right to receive form, every year we're going to mail you out after you retire. We're going to mail you out what's called a right to receive form. This is basically just verifying that you are not violating any of the rules of the pension plan. So you complete that and send it back. Failure to do so could stop your pension. So we usually do that every December, January. We mail out a right to receive. Very simple. You complete it, send it back. And then I mentioned about Social Security Disability Award. You cannot collect your Social Security Disability and your double bubble or your supplemental benefit. If you are awarded a Social Security Disability Award, you do need to send in a copy of that award to the pension fund office. Now, we talked about what happens to your pension when you come in to retire. We're going to talk about what happens with your pension if you're an active participant and what type of death benefits are available for pre-retirement. So unfortunately, if you're not at retirement age or have not retired yet and you do pass away, you should know that the Health and Welfare Fund will pay out to your spouse or your beneficiary $25,000 if it's a natural cause. They will pay out $35,000 if it's an accidental death. The health care for your spouse and your dependents would go until the end of the current benefit period, plus an additional 12 months. As far as your pension goes, your spouse would receive 1/2 of your accrued pension for her lifetime. An example, if we remember looking at Joe, his pension was worth $3,000 a month. In the event Joe passed away before retirement, his spouse would receive $1,500 a month for the remainder of her life. If there's no spouse, a lump sum payment would be paid out from the pension plan to your named beneficiary on file. Again, that's why I can't stress how important it is to make sure you have a beneficiary on file with the fund office in the event that you do pass away unexpectedly, that any of your retirement accounts get into the right hands. And your annuity and your savings accounts will be paid out that your spouse or your beneficiary would have the right to either cash them out or roll them over to another qualified retirement plan tax-free. All right, now let's look at an overview of your annuity account. Now, your annuity account is considered a cash balance or hybrid defined benefit plan. The annuity contribution is included in the fringe benefit package as a set dollar amount that gets allocated to your account for each hour you work. The account is credited with an interest rate based upon the average of the 30-year Treasury rate in the month of March before the plan year starts. And the plan year on the annuity, similar to the pension, starts every May 1st and ends every April 30th. For the 2021-2022 plan year, that interest rate credit is 2.34%. Now we're going to look at an example of how to read your annuity statement, and then we're going to look at your annuity options as far as payments when you come in to retire, whether it's a lump sum payment, a direct rollover, monthly payment options, and joint and survivor options. Okay, let's look at an example of your annuity statement. Now, All vested participants should have received their annuity statements in August. If you did not receive an annuity statement, please reach out to the fund office and we'll be sure to look into it for you. Now, as you know, your annuity account is broken into two accounts. There's account A, and they are for contributions before May 1st of 2018, and account B for contributions after May 1st of 2018. Both accounts are calculated the same exact way using the Treasury rate that I mentioned in a previous slide. For the 2021-2022 plan year, it's 2.34%. The only difference is account B is capped at 6%, where account A has no cap on the interest rate. So as long as the interest rate is under 6%, account A and account B will be calculated the same exact way. Now, the total of the two accounts is your total annuity account balance. So you would add account A and account B together, and that would be your combined year-ending total annuity balance, as noted on the statement. Now, let's look at payment options under the annuity plan. If you're a married participant, you will have 4 options. If you're a non-married participant, you will have 3 options. The first option is a lump sum cash out. For easy math purposes, hypothetically, say you have $100,000 in your annuity account and you choose this option, we have to tax it at 20% right off the top, and we would send you a check for $80,000. If you're over the age of 55, there's no additional 10% early withdrawal penalty. If you're under the age of 55, there's possibly an additional 10% early withdrawal penalty, and that would come at income tax time. The next option is a direct rollover, and it needs to go to a qualified retirement account per the IRS definition. An example, a traditional IRA is considered a qualified retirement account. You should note that we do need your rollover papers and instructions on who to make the check payable to and exactly where to send it. And if you are choosing this option, your financial institution should note that it could take up to 60 days before the money is transferred. And again, this would be a tax-free option. If you hypothetically have $100,000 in your annuity account and choose a direct rollover, we would send the full $100,000 tax-free to that financial institution. The next option is monthly payments, and this would be payable for a fixed period ranging from 1 to 15 years. This option is only available if you have at least $2,000 in your annuity account. More than likely anybody on this webinar would have more than $2,000 in your account. So a quick example of this is if you choose the 1-year, 2- or 3-year option, and hypothetically if you had an account balance of $120,000, your first year's payment you would get $10,000. If you choose a 1-year option, you'd get $10,000 a month. After 12 payments, your annuity account balance would be 0. If you choose a 2-year option, we would pay you $5,000 a month. After 24 payments, your account balance would be 0. 3 years, you would get $3,300 a month. After 36 payments, your account balance would be 0, so on and so forth. You should also note that this is considered taxable income, so you would be required to pay taxes on this amount. And the final option, and this is only for married participants, is very similar to how the joint and survivors worked on the pension plan. We could offer you a joint and survivor on the annuity. We would do a calculation based on the amount of money that you had in your annuity account and offer you a monthly payment under a 50% joint and survivor or a 75% joint and survivor. Under these options, you have to know that there's no guarantees on this election. So a hypothetical, say you had $200,000 in your annuity account, and we offer you a 50% or 75% joint and survivor option. You pass away 2 to 3 months into your retirement. Your spouse's survivor options on the annuity then start. She unfortunately only lives 1 or 2 years. The account balance is forfeited back to the fund. It does not get paid, the balance does not get paid out to a spouse or beneficiary. Again, there's no guarantees on this election. This is not a very popular option to choose. Now we're going to give an overview of the savings plan. Now the savings plan account is considered a defined contribution. The savings is included in the fringe benefit package as a set dollar amount that gets allocated to your account to each hour you work, similar to how your annuity account works. However, this account is a participant-directed investment account, meaning you have control on where the money can be invested. So we're going to talk about accessing your account, the mobile application to where you can access your account, your investment options, your payout options, and then hardship withdrawals under the savings plan. Now, how do you access your savings account? Now, the fund office is the plan administrator, but the Newport Group is the day-to-day record keeper and handles the day-to-day transactions for your savings plan. So if you're interested in checking your account balance or diversifying or moving some of the money around, how you access your account would be through the Newport Group. The information is also on the slide. I know there's a lot of information on here. There's also a dedicated 800 phone number that you can call Monday through Friday between 8 a.m. to 8 p.m. The information can also be found, and probably the easiest way is through the carpenters.fund website. We have a whole savings plan page dedicated to where you can access your information to get to the Newport Group website. The Newport Group also has its own mobile app, so make sure you download that to stay up to date on your account information via the app. As I mentioned, the savings plan is a participant-directed defined contribution account, which means you have options and control over where the investments fall. Now, there are a total of 15 investment options to build your portfolio. It's a mix of stable value funds, bond funds, large cap, mid cap, and small cap funds. If you're savvy enough to do your own research and build your portfolio accordingly to diversify your investments, my hat's off to you. And the Newport Group has some great educational research options that you can choose and check out and do a lot of that homework on your own. But if you're not and you're overwhelmed because this isn't what you do, that's okay too. That's why if you look on the slide above, you'll see the default funds. These are the accounts that are set it and forget it. Your money auto defaults to one of these accounts based on your date of birth and will adjust its investments strategy accordingly as you get closer to your retirement age and be a little bit more conservative with your investments. Now let's look at your payment options under your savings plan when you come in to retire. The first one being the lump sum cash out. Very similar to how the annuity account would work, is that if you choose this option, it gets taxed at 20% right off the top. If you're over the age of 55, there's no additional 10% penalty. If you're under the age of 55, there could be a 10% penalty, and that would come at income tax time. The next option would be a direct rollover. Again, very similar to how the annuity account works. It needs to be rolled over to another qualified retirement account. An example would be a traditional IRA. Once again, we would need rollover papers or instructions on where to mail the payment and who to make the check payable to. And again, it could take up to 60 days before that money is transferred. And another feature that not a lot of people know about is the savings plan hardship withdrawal. Now again, this is for members who are having a hardship at the time. In order to qualify for a savings plan hardship, you must be vested in the savings plan. You must have a balance of at least $2,000 in there. The most you can take out is 50% of your account balance up to $50,000. One withdrawal is allowed every 3 years. And most importantly, you have to meet one of the following 5 criteria. It's the purchase of your primary residence, to save your primary residence from foreclosure or eviction, to pay outstanding or upcoming medical expenses, for funeral expenses for you or one of your dependents, or for post-educational expenses for the participant, meaning you, or one of your eligible dependents. So if you do qualify for any of those criterias and you're interested in learning more about a hardship withdrawal, please contact the fund office or visit carpenters.fund. Also, a reminder to be on the lookout for more information on the Retirement Financial Awareness webinar that we will be hosting on Wednesday, November 17th at 6 o'clock. So look out for the invite and information on that. You can visit carpenters.fund to sign up for that. We will have certified financial planners talking to you about financial awareness into your retirement. With that being said, I'm going to turn it back over to Nicole and Cassie for the Q&A.
Hi, everyone. I hope that was informative for you. We're going to get started with the question and answer now. I have Nicole on the back end monitoring your questions. Again, if we don't get to your question tonight, it may have contained some personal information, and we will have somebody from the fund office contact you. I'm going to bring on Joe, the fund director, and Mike, the medical manager, to answer your questions for you. Here they are. There's Joe, fund director, and Mike, medical manager. All right, first question. I will be 56 next year with 25 years. If I retire, do I start collecting my pension right away? And I was wondering how much more it would cost me to add my wife to my benefits and keep the same coverage. I know I won't be eligible for the Class 1 coverage.
You want to take that, Mike?
Sure. Yeah. So if you're not eligible for Class 1 coverage, the cost to add your spouse really would be the same as you, depending on the age. So like we mentioned in that portion of the presentation, our retiree copays are age tiered. So if you're 62 and younger, same for the spouse you'd be adding, it'd be $135 a month. I'm sorry, it's higher. If you're not Class 1, it would be, what, $250?
Yeah.
If it's 62 through 64, if she happens to be older than you or same age, you would come down to $215. If you guys are both Medicare age, in that case, like I mentioned earlier, same price is $25 a month. But yeah, you would be eligible to add her on there.
Thank you. Next question. So if I have to call MD Live, they will call in my medical to CVS in South Carolina?
Yeah, so if you have to call MD Live, and that's a good reason to have that app already downloaded, make sure your information's in there exactly for this reason. If you're traveling to South Carolina, the advantage to it is that it's nationwide. So it's hooking up with a doctor in whatever state you have to be in. So it would recognize that you're in South Carolina at the time. It would put you in touch with a doctor who is also in South Carolina. And in that case, yes, they can call a prescription in. I'm assuming that medical means medicine. They can call a prescription into CVS down there. The one important thing that you do want to know if you are traveling, MD Live is not allowed, no telemedicine is really allowed to call in what they call a controlled substance. So Adderalls, painkillers, anything like that. They can't call those into another state. So unfortunately, you wouldn't be able to get that. But if you need antibiotics, anything of that nature, MD Live's the answer.
Great. Is there any plan for us to be able to see the years of service and credited years, as well as a pension statement online?
Yeah, thanks, Cassie. That's a very good question. Right now, currently, as Cassie mentioned at the very beginning, we do have that participant profile on carpenters.fund where you can see your annuity account balance. We are working on getting the pension statement and pension credit service up and running at some point. Obviously, it's not there now, but it's something in the future that we will be adding, and obviously we will notify you when that feature is available.
Thank you, Joe. Is the Cologuard test also covered?
Cologuard, I'm sure you've probably seen some of those commercials. I know they're running during Sunday football. Cologuard is not covered, but the ColoFit test that I mentioned earlier is essentially the same thing. It's a test that gets mailed to your house. You do the test quickly, mail it back. It's just for our purposes, we use ColoFit, but really same science, same principle. Make sure to go to that website and get a kit ColoFit as opposed to Cologuard. Mail it back and see where you stand.
What are the requirements to qualify for the supplemental pension?
To qualify for the supplemental pension, one, you have to be an active participant when you go to retire. It'd probably be helpful if we had the chart up that I was going through, but you have to meet that rule of 85, and you have to have at least, it's a tiering system. That's why it's if you have less than 10 years of service, you don't qualify. Anything above that, it's tiered. Anything over 30 years, you're going to get your full supplemental benefit.
Okay, thank you, Joe. I have a great follow-up question. It says, what defines a year of service?
A year of service is defined as anything over 800 or more hours in the plan year, and the plan year starts every May 1st and ends every April 30th. So if you have 800 of credited hours, you would earn 1 year of credited service.
Do you need to get a code for physicals at Patient First?
Another good question. Do you need a code for physicals at Patient First? No. And that's one of the advantages to it. So forever you had to call our office, you had to get an authorization code to go use the Carpenter's physical. Patient First, you just walk right in. We tried to figure out how to take down as many barriers as we could to make sure you're going to get that. So no, you don't need a code. It does help if you go to carpenters.fund and visit the Patient First page. The form they're going to ask you to fill out is on our webpage. Sometimes it helps to have that just on your phone in case they ask for it, but no code necessary.
Awesome. Will annual physicals still be covered at your family doctor?
Yeah, absolutely. And I apologize if I didn't say that. I know we're excited about Patient First, like I said, so I tend to harp on that. Your annual physical, and that's for member, spouse, or any of the kids, is covered once a year. In a perfect world, you'd take advantage of both. Get one through your family doctor and get one through Patient First. But yeah, the only difference there for your family doctor, make sure to use your Independence Administrator's card.
Okay, thank you, Mike. Next question. Do I still keep benefits when my hubby passes?
Yeah, well, really the same for either active or if you retire with healthcare coverage. I think Joe mentioned it also. You get covered for the remainder of the benefit period, unfortunately, when your husband passes away, plus 12 months. So as a quick example, if they were to pass away today, October 6th, you would get the remainder of October until November, our next benefit period, and then a year from that date. And then when that 12-month period runs out, we would send you out the Cobra paperwork. You can continue to pay for up to 3 years.
Can a spouse be added after retirement if I'm single at retirement?
Yes, and I'm not sure if you're specifically asking about healthcare or on the joint and survivor option. So I'll answer it both ways. Under the joint and survivor options, if you get married, the answer is no. You can't add your spouse to any of the joint and survivorships after you retired if you get married after retirement. You can, however, if you get remarried or married for the first time in retirement, you can add your spouse to healthcare coverage.
Okay. Here is more of a statement. Please consider Lehigh Valley workers when looking for dental, vision, and medical providers. Too many of us find it difficult to make long trips and appointments to Philadelphia.
Yeah, a statement, and honestly a good one. It is something that's plagued us for a while with our dental and vision network. There's advantages to doing it at the fund office. There's distinct disadvantages, and unfortunately one of them was that we had a hard time getting Lehigh Valley providers into the network. Also for the guys down in Delaware, we struggled with that as well. I mentioned the changes coming to the two big benefits, dental and vision, for May 1st. Keep an eye out. We're still working through, like I said, the exact plan design. But the one thing that we do know, and the one thing we really tried to make sure of when we were picking out a provider, is that the new provider will be a national one, where I think we have 600 dentists and most of them in Philly. We have about 100 vision guys right now, again, mostly in Philly. The new dental and vision providers are both national. You should have a lot more options up in the Lehigh Valley area, so you don't have to make that trek down to see us. Make sure to watch as we start to get that done for May of 2022. See how you can access that. Make sure you know where those doctors are.
Yep.
Okay. We were told that the pension will be going to a market-based variable rate. There is a rumor that as of 5/1/22, this coverage will occur. There is also a rumor that prospective retirees will be eligible for a double pension for hours accrued before 5/2022, and that those accrued after will only be at the variable rate and not doubled. Is that the thought process with the change?
I mean, at this point, there are no changes to the pension plan as of this point. There has been discussions on a board level that they are potentially looking at a merger with the New Jersey funds. If that is the case, whether it happens in January of 2023, January of 2024, or down the road, there is a possibility that the pension, the double pension would stop. However, the double pension just doesn't go away. So to answer your question, you would, if there is any type of change or any type of merger that would happen under the plan, whatever you have accrued under that supplemental pension
does not go away. You wouldn't accrue it going forward, but it does not just automatically disappear. You would still be entitled to that portion of the double bubble up until when that merger would potentially happen. But again, as of right now, there's nothing concrete. And if there is something down the road, obviously we would get in front of it and have one of these webinars to explain anything. But as of right now, there's just talk.
Okay, I have a question similar. Pension changes in the future were mentioned at a recent meeting. Will these changes affect retirees?
It's actually the same question. There's no changes at all in the pipeline as of today to make any type of changes to the pension plan.
Okay. Here's one. What if I have a lot of overtime hours over 30 years of service? Does that add to the years of service?
Overtime hours, an hour is an hour. So it gets credited for an hour. So if you work 45 hours a week, 50 hours a week, you get that money towards your pension. The more hours you work, the higher accrual you will earn. So even though you have 30 years, you max out your years of service under your unreduced early retirement at 30 years of service, or the rule of 85. We're going back to the slides now. I mentioned you can retire at 52 with 33 years of service. So if you retired at 52 with 34 years of service, you don't get a bump up of your pension for that 34th year of service. However, the extra hours that you work do go towards a higher accrual under your monthly pension.
Okay. If you decline health insurance because your spouse has it and they retire without insurance, can I opt back into the carpenter's insurance if under 62?
Yeah, so the question is, if you were to, let's say you earned the years, you're eligible for retiree healthcare coverage, and when you go to retire, your spouse is still working, so you could join that plan. It's not necessarily limited to age 62. If you were to join that other plan, but you earned our health coverage, you earned it, so it's yours. So whether you come back at 62, 64, or when you guys hit Medicare, if when you lost that coverage to your spouse, you wanted to come back to us, you would have that right. You just contact the pension department and let them know that you'd like to come back on, start paying the copay, and we'll put you back on healthcare.
Awesome. Thank you, Mike. When your child turns 26 and you elect to make Cobra payments to keep them covered, are those payments reimbursable through the HRA?
Yeah, that's a great question. So your kids are covered till age 26. The month they turn 26, they would terminate at the end of the month there. But if you do have the money in the HRA, Cobra is an eligible expense. And yeah, we would still honor that as a good HRA expense.
Next question. For the annuity monthly payout, would a beneficiary receive the remainder if I should die before the set payout time?
Thanks, Cassie. It's a good question. Under the monthly payment options, if we remember through the presentation, there was two options. One was the set payout, where you could choose up to 1 to 15 years in order to have a payout. The other one was joint survivors. Under the joint survivor, there's no guarantees. Under the 1 to 15 year payouts, if you choose a 2-year payout and unfortunately pass away, yes, that balance would then get paid out to a spouse or beneficiary.
Okay, thank you. If I take a job out of the industry after I retire and they offer insurance, do I need to take it? Can a spouse be added to retired insurance plan at a later date during the enrollment period?
Yeah, if you take a job out of the industry after you retire and they offer insurance, the short answer is yes, you would have to take that. It's considered an employer plan that isn't through the fund. The important thing to note, if that became available to you, you don't have to take the plan with the bells and whistles, the most expensive one, but you would have to take at least a medical plan. Can a spouse be added to retired insurance if we're talking about the carpenters? So let's say that you didn't have another job out of the industry, you're just covered under the carpenter's plan. Yeah, a spouse can be added back on, whether that's a new spouse after you retire, or if you were to have opted your spouse out, going back to that previous question. If just your spouse opted out at the time of your retirement and you took our health and welfare coverage, you could opt them back in at a later date. And we're not traditional in the sense that we have a true open enrollment period. It's not like if you miss January 1 that say you have to wait for the whole year. At any point in time, you write a letter into that pension fund and get them put on the coverage.
Thank you. So there are no consecutive years credited required to be eligible for the supplemental pension?
There's no set consecutive years of service, the rule of thumb is that you have to make up the time you were out. So if you were out 5 years and you have to be active, you have to make those 5 years back up to qualify for that supplemental pension.
Okay, thank you, Joe. That looks like all the questions we have tonight. If we didn't get to your questions, somebody from the fund office will contact you. This entire webinar has been recorded and will be uploaded to the fund's website and YouTube channel for future viewing. Thank you guys all for watching.
Thank you.
Thanks.